My interest in epilepsy began in medical school, the final years, during my medical thesis, which was about post-stroke epilepsy. I was really fascinated by how seizures can strike suddenly and in these patients and profoundly alter their perception, movement, and also sensation, depending on where they originate in the brain. So this initial experience was very important for me to understand that the study of seizures provide also a way, a window into the brain function, which is also clear, for example, in techniques such as intraoperative electrical stimulation, for example. During my residency in neurology, I worked also in glioma-related epilepsy, and I also did a visiting scholar experience at Stanford University. In the final years of my residency, I encountered my first cases of immune-mediated epilepsy, for example, in patients with GAD65 antibodies, and that can show very peculiar seizure types, such as pilomotor or musicogenic seizures. And so at that point, I was really fascinated by this new world of autoimmune encephalitis and paraneoplastic neurological syndromes that became the central focus of my research. I would not say that there are major gaps in the treatment or diagnostic availability in my country, in Italy, because we are fortunate enough to have a universal healthcare system that provides access to all the standard diagnostic tools and therapeutic options for the patient. But having said that, it's true that in the condition in which I focus on, so autoimmune encephalitis, it's true that there is a huge complexity in making these diagnoses that are quite challenging. And in fact, there are diagnostic delays that are common across all over Europe. For example, some of these conditions, such as anti-LJ1 or anti-Caspar2 associated encephalitis, may present in patients with normal CSF and normal MRI. So it's clear that the diagnosis remain challenging. For example, to address this problem, in many countries, there are reference centers. For example, in France, there is a French reference center in Lyon. I know that the German network, the Generate network, provides national level diagnostic guidance and also therapeutic guidance. And also within Italy, we are currently working at a national level with the Italian network of autoimmune neurology that is called NINA to harmonize the diagnostic pathways and to enhance access to second-level antibody testing because many new antibodies are discovered and identified every year. So we need to work at the national level and to collaborate between centers. First, despite the fact that autoimmune encephalitis and paraneoplastic neurological syndromes are relatively rare, they are important because they provide very intriguing mechanistic models to understand how immune-mediated attacks can trigger seizures and how the immune system can both control the tumor on one side and damage the nervous system on the other side. So their relevance extends well beyond neuroimmunology and well beyond epilepsy, and they are important for all doctors, I think. Second, seizures in these patients are often poorly responsive to anti-seizure medication, but may improve dramatically with timely immunotherapy, including, for example, corticosteroids, plasma exchange. But in many cases, we need to adopt also second-line immunotherapy, so they are very important. Early recognition is also crucial, I must say. And the third aspect is probably that it's very interesting that similar condition to the one that I mentioned can be triggered by cancer immunotherapy with immune checkpoint inhibitors. And so as the use of these treatments continues to expand, neurologists in general should expect to encounter these disorders with increasing frequency in the future, and they represent a very fascinating model to understand the immune tolerance breakdown.